Hello, Science Voyagers, and welcome back to Decoding Long COVID, Dexamethasone, and Beyond. I'm Dr. Shikha Agrawal, steering through the turbulent seas of this condition. After exploring dexamethasone's molecular magic, I'm eager to contrast its role in the stormy acute phase of COVID 19 versus the lingering fog of long COVID in today's episode on acute versus chronic dexamethasone's shifting roles. Once again, we have Prachi here, our microbiome navigator with a passion for bioinformatics, ready to chart the course. Prachi, let's dive in. How does dexamethasone's use differ between acute COVID 19 and long COVID?
I am excited to be here, Dr. Shikha. Thank you for having me once again.
Well, Prachi, dexamethasone was a lifesaver in acute COVID 19. But long COVID's a different beast. How does this role change between these phases?
You're right, Dr. Shikha. It's a tale of two storms. In acute COVID 19, dexamethasone tackled the cytokine storm, a hyperinflammatory state driven by IL 6 and IL 1 beta. The 2020 recovery trial showed it cut mortality by 17% in ventilated patients, acting like a dam against a flood. In long COVID, the inflammation is more like smoldering embers, causing chronic symptoms like fatigue. Here, it used off label, often at a lower dose, 4 to 6 mg daily, to ease those symptoms. A 2024 Open Forum infectious disease study found it helped 45% of long COVID patients with elevated cytokines, but it's less effective for neurological issues like brain fog. The microbiome's a factor. Acute use causes short-term dysbiosis, but chronic use risks longer disruptions, as a 2023 gut study showed with a 25% drop in Faecalibacterium.
So it's a firefighter in acute cases, but a cautious gardener in long COVID. How can bioinformatics help us tailor its use across these phases?
Exactly, Dr. Shika. Bioinformatics is like a high-tech compass. In acute COVID 19, transcriptomic profiling spot patients with hyperactive cytokine pathways who need dexamethasone. In long COVID, metagenomic sequencing reveal microbial signatures tied to treatment responses. A 2024 Nature Communication study used machine learning to predict dexamethasone efficacy. Patients with high clostridium levels responded better, likely due to anti inflammatory metabolites. This helps us optimize dosing and minimizing microbiome harm, ensuring we are not just dousing the flames but nurturing the soil.
Prachi, you have navigated us through a sea of insights. You have shown dexamethasone as a firefighter in acute COVID 19's storm, saving lives, and a gardener in long COVID's fog, tending to chronic inflammation. That 45% symptom relief is promising, but the microbiome's vulnerability is a wake up call. Prachi, what's your key reflection?
That sea metaphor is perfect, Dr. Shika. Dexamethasone role shift with tides, but we need precision to avoid rocking the microbiome's boat. Bioinformatics is our lighthouse, guiding us to personalized treatment. We are sailors charting long COVID's water with science as our wind.
Thank you, Prachi, for shedding light on this important topic. And to the listeners, thank you for joining us. That concludes today's episode. If you liked the episode, subscribe, share, and join us on social media with our hashtags. Let's sail through long COVID's mysteries. Stay curious.